Good afternoon. Nice to meet you again. So let me introduce my topic, which has the title of Effect of Tumor Necrosis Factor Alpha Inhibitors on the Outcome of Major Long-Term Complication in IBD Patients. I'm Hajnal Székely, working as a medical doctor at Semmelweis University, Department of Surgery, Transplantation and Gastroenterology. As a PhD student, I have my supervisor, Pál Miheller, and my SMS, Anett Rancz. My vision is to improve the quality of care of IBD patients by extending the knowledge regarding several aspects of this really complex systemic disease. In this regard, we choose to examine two major complications of IBD patients. First, the venous thromboembolic events, and the second topic is going to be relating to the IBD-associated colorectal cancer. The first topic we started in September, the second one in December. So regarding the first part of the topic, we are trying to assess the effect of anti-TNF and conventional therapy in inflammatory bowel disease patients in venous thromboembolism. It is well known that the prevalence of the disease is highest in developed Western countries, where the prevalence is still increasing due to aging population. Meanwhile, the incidence of the disease is increasing in developing countries, so it is considered that IBD has a global relevance. Those patients suffering from the disease are considered to have a 2- to 3-fold increased risk of venous thromboembolic events compared to the general population. If these complications appear, they are considered to be relevant cause of morbidity. They are going to result in prolonged hospitalization, and they do tend to recur. But most importantly, they may be potentially fatal, so their mortality rate, it is reported to be varying between 8 and 25%. Regarding the clinical appearance of these complications, the vast majority of them are going to be presenting in the form of deep vein thrombosis or pulmonary embolism. So VTE in IBD is considered to be multifactorial. So several risk factors should be mentioned, but we are underlying here the disease-related risk factors, as the disease activity and the consequent hospitalization are known important provoking factors. So tumor necrosis factor alpha, it is known to be a key driver of the inflammation in IBD, and at the same time, it may be activating the coagulation cascade. So by inhibiting this molecule, we may achieve not just remission of the IBD, but at the same time, we may decrease the risk of venous thromboembolic events of these patients. So our aim is to compare the effect of anti-TNF drugs with conventional IBD therapy in the regard of venous thromboembolic events. And for the clinical question that we just formulated, we choose the PICO framework, and our hypothesis is that anti-TNF drugs are associated with the decreased odds of venous thromboembolic events, with the clinical implication of improved care of those patients who are considered to be at high risk of these complications. In this regard, we conducted a systematic search at the end of November in the most important databases, with the search key containing 3 domains. First of the disease by itself, the second one containing the complication, and the third one, the chosen biological drugs. You see here the flowchart of selection. Till now, we achieved the full text selection. So the second part of the project, it aims to compare the tumor necrosis factor alpha inhibitors in IBD patients in the regard of colorectal cancer. So it is well known again that these patients, compared with the general population, they do have an increased risk of colorectal cancer. These malignant diseases tend to occur at younger age. They are more likely to be multifocal, and they have a worse prognosis or a more aggressive course, and accounting for around 10–15% of patients' death. In this regard, the malignant diseases, it is considered that the dysregulated inflammation is the culprit of both IBD and colorectal cancer. So the pathogenesis in this regard continues the inflammation dysplasia carcinoma sequence. So again, here, by achieving a proper and long-term remission of patients with IBD and mucosal healing, on the long run, we may decrease the risk of colorectal cancer. So our aim is to assess in this category of patients, again, the role of anti-TNF drugs. The clinical question that we just choose is, do anti-TNF drugs decrease the odds of IBD-associated colorectal cancer compared with other anti-inflammatory drugs? And here, again, we choose the PICO framework. Our hypothesis is that they may decrease the odds of IBD-associated colorectal cancer. And if it's true, that it's going to impact the long-term complication of IBD patients. In the regard of this second topic, we just built a preliminary search key containing 3 domains of the IBD, of the IBD-associated colorectal cancer, and again, the chosen category of drugs of TNF antibodies. We found some key articles, but the feasibility of the topic is still under control because we have a previous meta-analysis published last year, which is a relatively new and really detailed systematic review and meta-analysis, but no Prospero registration in this regard. So in summary, I'm just showing you again the 2 complications of IBD patient that we choose to study and the drugs that we aim to assess their role in these events. The first is the venous thromboembolism, and the second one is the colorectal cancer, and you see here the planned submission dates in this regard. By thanking you for your attention, I'm finishing with this quote. The scientist is not a person who gives the right answers, he's the one who asks the right questions. So I'm not prepared with the right answers, but you may ask me the right questions. Thank you.
Thank you for an excellent presentation. I got 2 questions. First is regarding both of the topics. How we are going to deal with patients who will fail, who will be no responders for anti-TNF, and they will have to go like 2nd generation anti-clonal therapy. And my second question is regarding the first topic. If you are interested also in atypically located thromboembolic events in these patients.
So thank you for your questions. First, we planned to just assess the role of 2nd generation biologicals also, but there are really few data in this regard because if you consider there's a really small proportion of patients that we are looking for. So as you saw, the venous thromboembolic events are present in 1 till 8% of IBD patients, and taking into account also the medications, there are no data in this regard yet available. Obviously, as the time goes by, it's going to be an interesting topic to search for. I did not mention that more than 90–95% of the cases is deep vein thrombosis and or pulmonary embolism. The other localizations are a rarity in this regard. There are just a few, 1 or 2 articles that are that just reported several cases in this regard. Obviously, if data is going to be available, we are going to check for this also. But again, it's a really small percentage of the patients affected.
What's your opinion in your daily practice about the second topic, that how many % of the cases that you give biological and non-biological therapy for the patient with Crohn's disease or IBD who get a monotherapy and not a combined therapy?
On the long run?
Anti-TNF or non-anti-TNF? Because I'm thinking that you have to change the biological and the whole therapy in these patients with Crohn's disease or colitis. Yes? You have to change several times, generally. Not? Or because I'm thinking that the heterogeneity of your population
really huge, yeah,
will be very, very high.
So we choose this topic because of the fact that till today it's still a debate whether any type or any category of the drugs used in IBD, they do have a really strong chemopreventive effect. So only the 5-aminosalicylates and only on ulcerative colitis patients given on the long run may have this effect. So the guidelines are stating that you may give these type of drugs for these patients with this role. But regarding immunosuppressants, there are new data, although conflicting still. And we choose this topic because it's interesting in the regard to find out if these newer drugs are going to have any effect in this regard also. Your question is really important also because we cannot, we try to find articles which are reporting differently this, so the medication of the patients. Although in the practice differs slightly from the reported articles or may differ. So there are many confounding factors in this topic also, which makes it relatively difficult to find proper data.